Thank you for coming. So today I'd like to provide you an update on our cases in Waterloo Region, as well as new recommendations from the province on the testing of people who have traveled and have respiratory symptoms. And thirdly, new recommendations for our community. Regarding our cases in Waterloo Region, the third confirmed case that we reported on yesterday, a male in his 40s, was assessed by public health, and he was initially assessed and tested and then went home to self-isolate. That said, later on that day, he returned to a hospital setting as his condition became more serious. He is currently hospitalized and in stable condition. Additionally, late last night, we received confirmation of our fourth confirmed case. A female in her 50s acquired the illness during travel to France. She developed symptoms upon her return, for which she was tested at Grand River Hospital. Hospital staff took all necessary precautions to ensure the safety of staff and other patients. The patient was experiencing mild respiratory symptoms and has been released from hospital to self-isolate at home. Public health is monitoring her, as well as close family members who are not experiencing any symptoms at present. Second update is in regards to testing. Given the evolving situation and the need to ensure that those who may need more elevated levels of care are able to receive the assessment and care that they need, as of late last night, Ontario updated its recommendations for testing. In general, testing will be prioritized for people who need hospital care or certain groups of people such as healthcare workers or those in long-term care homes or retirement homes. For most other people who develop symptoms such as fever and cough and have traveled to an affected area, testing is no longer recommended. They will still need to remain at home in self-isolation until such time as they are no longer symptomatic for 24 hours. By taking these following this is the third update. So given the evolving situation in the world, by taking the following measures that I'm going to outline to you, we have the opportunity to slow the spread of virus in our community. These recommendations reflect the changing risk around us, even though the risk in Waterloo Region hasn't changed. It is my recommendation that large gatherings of 250 people or more and all international events be postponed or canceled. This does not apply to post-secondary institutions and workplaces at this time. I am speaking of large gatherings where there's a difficulty for people to potentially withdraw themselves if they develop symptoms, where there's a greater propensity for overcrowding. That said, post-secondary institutions and workplaces are encouraged to consider increasing flexibility for their students and/or workers to work from home or work remotely, should that become recommended in the future. Second recommendation, Waterloo Region residents postpone all non-essential travel outside of Canada, including to the United States. Third recommendation, returning travelers to Waterloo Region refrain from visiting patients in hospital, visiting long-term care homes or retirement homes, visiting the elderly or those with chronic health conditions. In addition, children who have traveled outside of Canada should not return to childcare settings, including daycare and camps, for 14 days. Finally, returning visitors from Hubei Province, China, Iran, and Italy need to self-isolate for 14 days from their date of return. And returning visitors from all other countries, including the United States, need to self-monitor themselves for symptoms for 14 days from their date of return. And last but not least, I ask that our residents refuse to participate in Ezra Street Party. This uncontrolled, illegal party was already a significant risk to the health and safety of our residents. It is even more so now. In this time when we need to ensure our health care and community resources are available to respond to serious needs in our community, I am asking people not to put their own health or those essential resources at risk. I'm asking people to please do their part to protect our community. Finally, I'd like to let people know that public health is currently experiencing high call volumes, and so people may experience longer wait times on the phone. We apologize for this inconvenience. We have increased staffing significantly in the past few days, and we are adding additional staff as quickly as we can. Thank you, and I'll be happy to take any questions.
Thanks, Julie. We've got copies of that statement, which we can distribute to the media so you can have a more detailed outline of that.
Hi.
Julie?
Yes.
Any questions? Or?
Hi, Liz Montero from the Record. Dr. I just wanted to ask you specifically related to Ezra. And so you're asking citizens or people to refuse to participate in Ezra. So you're asking, not telling. So I'm just wondering how much you can enforce that. Because the chief this morning also pleaded with an emotional appeal to ask partiers not to go. But we expect that some people may attend. So how do you, other than appealing, encouraging, asking, can you do anything else to make sure they don't show up?
No, I cannot enforce that recommendation. No.
Okay. All right, so you're just relying on their good sense to not come up.
Yes, I hope that they listen. I hope they think about not only themselves, but about our healthcare and community resources that need to be available and not tied up with things that are unnecessary at this time. So I'm hoping that they think about that. Hi, Catherine.
Hi, it's Catherine Thompson from the Record. I have a bunch of questions. I'm just wondering if you could clarify, just with regard to the cases, the man in his 40s who was the third case, when did he present?
Yes.
When was he hospitalized? And you said he's in stable condition. If you could clarify, is he in stable condition in ICU? Is he in stable condition?
Yes.
So,
yes. So yesterday when I announced the third case, I had said that he had been released from hospital and was recovering at home. Later on in the day, he went back to hospital. And he is currently in hospital, and I won't specify where in the hospital, but he is in stable condition.
okay, I just wondered if you could also clarify with regard to family members of those cases that have been diagnosed. What is the recommendation
Yes,
from your office for those people? Do they have to self-isolate?
yes,
Do they have to be tested? I don't know.
yes. So, yes, they need to self-isolate if they've been in close contact, which usually family members have been. And they definitely are cooperating with us when we ask them to do this. And we no longer will be testing people who do not need hospital care. So right now, though, for the cases that I have announced in the past, their contacts were previously tested, and we're still awaiting some results from that. But going forward, I apologize. Contacts of cases will be tested still. So yes. So if their contacts have symptoms, then they will be tested.
So they'll be tested, contacts will be tested if they have symptoms?
That's right.
Okay, thank you. I also had some questions. Do you have any idea how many people in Waterloo Region are in self-isolation right now?
I don't have that number offhand, but I don't have that number offhand. But
is it like a handful? Are we talking dozens?
I would say there's, there are dozens of people, because if you have returned from a high-risk country, or actually, there's more and more countries that have cases, and so if you've returned from a country that's been affected and you have symptoms, you are to self-isolate. So there are dozens and dozens of people that are self-isolating in our community, yes.
Okay, thank you. I just wondered if you had any directions or recommendations with regard to people visiting long-term care and the elderly and vulnerable.
Yeah, so the risk right now is really with returning travelers, and so that is why I am asking returning travelers from outside Canada to refrain from visiting long-term care homes, retirement homes, or even just visiting with elderly people with chronic health conditions for 14 days from their date of return.
But for the rest of the population, it's still fine to visit your elderly loved ones, okay?
Yes.
I also wondered if you could clarify if there's any directive or recommendations with regard to what strikes me as another vulnerable population, but I don't know if they are like homeless people, shelters such as St. John's Kitchen. Are there any special recommendations or?
So we're working with the organizations that service these populations to make sure that they have our recommendations in terms of how to make the settings as safe as possible.
So at this stage, we don't have any decision to close shelters and have people housed in hotels or anything like that?
No, not at this point.
Okay. Can you give any indication when testing centers? I know there was some discussion about testing centers.
That's a good question. That was when we were testing everyone.
Right.
And we were testing mild cases, and that was the direction from the province. But now the direction has shifted. And so we're going to reassess whether the assessment centers are still needed, because this is going to cut down considerably on the number of people that need to be tested. So the mild cases in the community will no longer need to be tested. They will need to stay at home, though, and self-isolate until their symptoms are no longer there, and for 24 hours after their symptoms are gone. So
we don't plan to have testing centers.
I'm going to have to reassess that. I can't say at the moment, but we're going to have to see what these new testing requirements do to the volume of the volume in terms of patients who need to be tested.
Right.
Yeah.
I'm not sure if my numbers are hazy on this. My understanding, was it like 90-ish yesterday that had been tested?
Yeah, it was about 2 days ago. We have actually more than 90 that have been tested. We have a lot more, but we've had 90, as of yesterday, we had over 90 that had been tested and had come back negative. But there's been quite an increase in the number of people that have undergone testing in the last couple of days even. And so there's dozens more that have been tested and for whom we're awaiting test results.
Okay, thank you. That's it for my questions. I don't want to have the answer on
So this is Carmen Rowe with CDC. Question about Azure Street.
Yes.
There are hundreds of other students that are coming out to Azure Street.
Yes.
Other different communities and different universities.
Yes.
Is public health in contact with other public health from other cities with these recommendations, but not attended?
Well, there's been a recommendation across the province to not have gatherings that have more than 250 people. And so all public health units are aware of that. Obviously, there's nothing we can do to stop people from gathering if they want to gather, but I really hope that they listen. And I really hope the word gets out, and I really hope that people are not only going to refuse to go, but they're going to encourage their friends and acquaintances to not go either.
Are hospitals going to be prepared if people end up coming out?
Yes, my understanding is that the healthcare partners, as well as the, community partners like police and city, they have plans in place for Ezra, and if the situation escalates, so I believe they're well prepared. The reason I'm asking people not to go is because it's already a very unsafe environment. Even if we did not have coronavirus, it would be a very unsafe environment. But given the evolving situation with coronavirus and the fact that we really need to have availability of our healthcare resources and our other, community resources, in case there is an escalation of need for those types of, healthcare resources, for example, we need them to be available and not tied up, treating injuries from a completely unnecessary and dangerous event.
And also yesterday when we spoke, a woman in her 60s who came back from the cruise, you mentioned that there's 2 family members
Yes.
who traveled with them.
Yes.
Do we have any update on their cases?
We don't have at this time, no.
Thank you very much.
Okay. Hi again.
Hi again. Sorry, I just thought of another question.
Sure.
I just wondered if you could just, so there's this, is it a recommendation or are you actually banning?
I can't ban. I know there's been,
Sorry, I'm not talking about that.
right.
Gatherings of more than 250.
No, it is a recommendation.
Right.
Yeah.
So I'm just wondering if we could just flesh that out a little bit, what that looks like. Are we talking about we can't go to concerts at Senator Square, we can't go to the movie theater? What does this look like?
It's about large gatherings where it's going to be there's a difficulty where there's a greater risk that there's overcrowding and people cannot isolate themselves easily. So if you're in a movie theater, for example, or you're in a classroom, you could, if you start to get symptoms, just leave, right? You're not in a situation where you have people around you and you're so crowded you potentially can't get out of the way, so to speak. So that's what I'm talking about. Environments where there are so many people that overcrowding becomes an issue, and there's not enough sort of space between people.
Events are we talking about other than Ezra?
Other events, they could have, for example, if you have other public events where there's a lot of people congregating together. Festivals, thank you, Mayor. So festivals are an example, yeah.
But things like a wedding or a concert at Senator Square can still proceed? I'm just trying to clarify for people, right?
Yeah. It's environments where it's environments where you don't have that orderly sort of distribution of people where you can have a lot of difficulty in making sure that people can, pull themselves out of the environment should they have symptoms, where there's a greater risk of being really overcrowded.
Okay.
Yeah. So it's not it's it depends. I would have to, it's not just the fact that there's 250 people. It has to be 250 people that are in a very crowded environment, in a cramped, not cramped necessarily space, but they are very, very close together.
Okay. If you guys could provide examples maybe on your website, because that's the kind of thing I think people will be looking for guidance about.
Yeah.
Thank you.
Okay. Yeah.
There's one more question. I'm just
Sure.
wondering too, have any doctors been tested for the virus in the region?
We don't reveal people's professions if there is no association with risk.
And also, in terms of gatherings, what about the farmers market, and transportation?
Yeah, that would be an example of where we would discourage gatherings. Yes, so festivals, markets. Hopefully that helps a little bit. No?
Due to the length of the preceding program, we now join the regularly scheduled program already in progress.
Is a great way to do that. There are lots of professionals that have their own Twitter or their own TikTok or their own whatever, and just follow them and, comment on their stuff, tag your stuff. Don't be impatient about it, but be consistent.
Yeah, absolutely. And if you guys are looking to follow Brad on social media, I believe it's at Gold Record Daddy.
That's on TikTok and on Instagram, and it's just Brad Macri on Twitter.
Okay, great.
Yeah.
Brad, thank you so much.
When I get up in the morning, the first thing I do is put on my yarn.
Jaylen's been able to have the prosthetics and have the support that she needs because of the people who donate to the war amps.
My arm helps me to pick flowers.
She can do things on her own. She doesn't need someone else to do it for her.
I love all the pretty colors of flowers, but yellow's my favorite color.
Calling all bowlers for the 5th annual Roll and Bowl Tournament in support of Spinal Cord Injury Ontario. It happens on Tuesday, March 24th, starting at 6 p.m. The fundraiser is being held at Binghamton's Kingpin Bowl Lounge. The Roll and Bowl will raise vital funds for people with spinal cord injuries and other disabilities. This year's fundraising goal is $10,000. All you need is a team of 8 and lots of enthusiasm. The minimum donation to participate per person is $50. For more information about the 5th annual Roll and Bowl Tournament and other upcoming events, visit sciontario.org. There are only 20 lanes available, so register early to avoid missing out for the 5th annual Roll and Bowl Tournament in support of Spinal Cord Injury Ontario. Build a team, rebuild a life.
Welcome back to Think Millennial. We're so happy to have you join us here. My name is Ben.
I'm Tiffany.
Still, right? We're still here.
We're still here. Got to get back into the swing of this.
Yeah. Today we're joined by Rachel Sanko-Strasser. thank you so much for joining us from Up Yoga and Wellness.
Thanks for having me.
Brand new endeavor.
Yes.
And that's something, it can be scary to jump into something new.
Yes.
To start fresh.
Especially when you're 5 months pregnant and you're in the mix of running a new business and thinking, what am I doing? Am I crazy? But it feels right. It feels good.
That's awesome. So do you want to give us a little bit of history around how you got to this point of starting?
And where are you located?
St. George, downtown St. George.
Okay, right.
In this really cool building. It used to be an old mill. And it's just gorgeous. Really high ceiling, stone wall. It's a beautiful space.
Nice. Well suited.
Good
for
vibes.
yoga.
Yeah, definitely.
So yeah, sorry to cut you off. I just want to make sure we got that out there. But yeah, how long what was the process kind of look like, or how long has this been in the brain or in the works, or to come about, or to find a place, or so many questions. Sorry.
So many
sorry,
questions. How much time do we have?
Yeah.
Oh man. Health and wellness, it's Up Yoga Health and Wellness. I'm an integrative nutrition and health coach. So I do a combination of holistic nutrition, lifestyle wellness coaching, and some life coaching in there too, because I'm a firm believer that we are not healthy based on just what we eat. In fact, research shows that more than what we eat, lifestyle factors like how much sleep, how much play, the quality of our relationships, the people that we surround ourselves with, how they influence us, exercise and movement, breathing, how mindful we are of toxic thinking patterns. All of these things really impact our health in a pretty profound way. And so going back to probably 15 years ago, I was always somebody who kind of struggled with my health and did a lot of body shaming, really didn't understand my body as a whole, and was frustrated with my skin, was frustrated with my weight. Not that weight is a determinant of how healthy you are, but I've always wanted to feel good in my skin. And for everyone, that feels different and looks different, right? And so I went on this journey of basically researching, and my undergraduate is in biological sciences. And I found that randomly, there's a big connection between the gut and the brain and just overall health. And so I started Gutsy and Glowing, which is based on the premise that the seeds of health are planted in your guts. And there's a huge connection between gut health and the brain health and the gut, this bidirectional relationship that affects everything from digestion to how we process stress, anxiety, our ability to nourish ourselves by extracting nutrients from our food, and to longevity. There's a lot of research linking the gut health to how long that you'll live, which is kind of crazy but cool.
Yeah.
So the gut part for all over health, but then the glowing, because when our gut is healthy, it really impacts our mind, it impacts our emotions, the way we feel, how much energy and vitality we have. And of course, if you feel good, you'll do good. Right.
So then you took that business and sort of shifted. I mean, it's probably still a part of your Up Yoga for the fact that it's like all kind of the same thought process and whatnot, but then you sort of shifted into wanting a more physical space and something to do your yoga practice as well.
So I started to do a lot of one-on-one nutrition and health coaching, and I found that a big part of getting people to shift their lifestyle in small, sustainable ways was movement and getting into their body. And so I wanted a space where I could partner yoga and movement, but also offer as many workshops, have clients come to my space, and really make it a lifestyle education space where people can get information, because when you know better, you do better. Most people do what they can with what they have. And so when you know better, you do better. And I just want to help people feel better, to move better, to breathe better. We talk a lot about time management and how our lives are so busy today. I really love teaching people how to manage their energy versus managing time.
Yeah. So